Hello, everybody. This is Dr. Howard Robbins once again here on Functional Medicine with me, Dr. Howard Robbins. And thank you all for giving me the time and listening to our podcasts. And oh, please subscribe. They keep telling me that's an important thing to tell you to do. It's free, and it certainly helps us with our broadcasting and doing new episodes. I want to thank my sponsor, doctorsbiome.com. You're going to find out why it's helpful and what we're going to talk about, among other things, on this show on headaches. So let's get right to it. And by the way, Doctor's Biome is available at doctorsbiome.com. That's doctorsbiome.com. You're going to learn about how probiotics have an effect on this, as well as other things, and I think it's something important for you to consider. So let's start with people get headaches. There's probably no one listening while you're listening to the show because maybe you get chronic headaches or migraine headaches. There's many different causes of headaches. And obviously, if you understand the causes of it, sometimes you can fix it just by adjusting. Some are lifestyle created. If you're in a state of dehydration, most Americans walk around in a state of dehydration. Most people need to drink 3 to 4 liters, 3 to 4 quarts of healthy liquid every day, and they don't even come close to that. I'm sure you don't. There's many reasons why you don't drink, but point being, dehydration, one of the major causes. Some people have low blood sugar. Skipping meals can cause this to happen. Low blood sugar is another major cause. Not sleeping well. Maybe you're not getting healthy sleep. That's very important. Sleep is essential to having a healthy body. But without enough sleep, you don't rest your brain enough, and this can lead to headaches. Stress, we all know everything is stressful. A slap in the face is stressful. A kiss is stressful. Getting married, getting divorced, everything is stressful. All right. But the bottom line is if you're under a lot of stress or if you suffer from anxiety issues, this can lead to headaches. And there's medical causes that lead to these things. Perhaps you drink alcohol. If you drink excessively, this can cause headaches. It's probably the things in your life that may be leading you to drink alcohol, those kind of stresses. But alcohol is not the answer, and it can lead to severe headaches. Sometimes if you get too much caffeine, if you're a big coffee drinker or strong tea drinker, all right? And then there's so many of these caffeinated drinks that can really load your system up. And sometimes you don't have enough caffeine in your body. That can lead to headaches as well, particularly if your body has gotten used to it. Eye strain. One of the things I can't fix is presbyopia, getting older. At the time of this filming, I'm 78 years old and I do need glasses. Fortunately, my prescription changes very little over the years and I don't need very much help. In fact, outdoors, when there's a lot of sun, I can read without glasses. But certainly, if you need eyeglasses and your prescription isn't right, that can lead to headaches. And also, if you're just looking at a computer or watching television too long, looking at iPads or your cell phone constantly can lead to eye strain and lead to headaches. And then there's, oh my God, medical causes. A lack of circulation to the brain can cause migraines, and you can have that because your circulation is closing down. There are tension headaches caused obviously by stress. Sinus inflammation, sinus congestion can cause that. You may have chronic sinus problems. High blood pressure. Many people suffer from high blood pressure. This causes headaches. Certain medications, if you're on medications, can lead to it. TMJ problems, where you have pain here in your temporomandibular joints. Dental issues can lead to headaches. Perhaps you have neck strain or tension in your neck for mechanical reasons because of your posture, the way you sit, the way you hold your head. That can lead to it. Muscle weakness from things like ALS and multiple sclerosis can lead to this. Certainly, if you have severe headaches, you got to seek medical attention. Many years ago, I started the oxygen bar business in the United States. And one of the major ways being used in certain health clinics around the world is giving you oxygen by nose or even by mouth. oxygen, medical grade oxygen, help knock out a migraine headache and many headaches. Get headaches, very often they're sinus related, and this could be caused by allergy or sinus congestion. And if I say get them, I get a headache, I have to admit. Okay. I do things that I do, I'm very, and this show is dedicated to natural approaches to treating these things. So what I do is shiatsu, okay, sometimes called acupressure. And there are certain pressure points that work along the energy meridians in your body that can make a major difference in eliminating a headache. And you don't have to really learn this, go to school for it, though it's not a bad thing to do. It can help your whole body and treat many different things. Or you can go to see a shiatsu expert or an acupuncturist if you suffer from chronic headaches. But there are things you can actually do at home. Okay? The way to know what you're doing is no pain versus I feel pain. It's almost like a Geiger counter for pain. So you press along your eyebrows, right along the crest of the bone here, and you press on both sides, okay? You feel pain, you stop, and maybe you move on a little bit, little movements till you get to where it's hurting the most. And then what you do is you press, and I rub gently. Notice my hand is moving in a circle, even though my fingers are not coming off the points. And you increase the pressure. Yeah, it's going to hurt because these are blocked meridian points. And when the whole, and you're on that place and you're pressing for 30 to 45 seconds and then relax and move on and make sure you didn't miss the point. Then underneath the bone in your eye socket, you start here and you start the pressure. And if you find the place that hurts, once again, don't push in on your eye, push up on the bone. And you push up on the bone and you hold it for, again, with those gentle movements in circles for 40, 45 seconds. Then right over here, you compress. You can do it this way. I like to do it this way so I get both sides at once. And you find the point here. May not hurt, but these are sinus points that can open up for the headaches. And you compress there. And if it hurts a little bit, it says that sinus may have a blocked energy point due to infection or congestion for some reason. And then over here, right below your nose, on either side of the separation here, and you press here. Repeat those pressure points 3 times, each time for 40 to 45 seconds. Then you can press here in the middle of your head. Here, find a place on top of your head that may or may not be painful. And then there are points behind your head, right over here. And you can, if any of them are hurting, you press right up again, 40 to 45 seconds, and mosey on down both sides of your neck and press on those points that may be painful or tight. And again, 3 sets of 40 to 45-second pressure points. That's a mechanical way of dealing with headaches, depending on what's causing the headache. These points are great for sinus issues, and then the others are for stress and other causes of it. They may not work on their own, but you don't know until you try. Give it a few tries. And the beauty is you can repeat it as often as you need to. May alleviate headache or reduce the pain for a period of time. It seems to be coming back. Do it again. There's no harm in doing it as often as you feel it's needed. There's supplements that people can take who have chronic headache problems. Very valuable, the glycinate or the citrate form of magnesium. Give out amounts, generally speaking, because each person is individual, and there's ways of doing testing that we use to determine how much a person may or may not need. So I can't just say take this amount or that amount because I don't know that's how much you as an individual do need. You can experiment. Most of these things are safe. You start with a small dose and increase the dosage, and you may want to take it a couple of times a day when you're dealing with magnesium. B2, riboflavin, same thing, 'cause since it's a water-soluble vitamin, you can take it a couple of times a day and not have to worry about it. Of them come in B complex forms. We have all the different Bs, so just make sure that B2 is in there or buy it separately if you're having this. And then the omega-3 fatty acids. Helpful. It's been proven through studies to be helpful in this. There are foods such as, and I don't like to take the dried, that come in capsules. I prefer you eat the real thing. So ginger, you can chew on some of that. If it's too strong, put it into a beverage or something that you may want to drink. You can fit into a delicious drink with other green juices and things like that. Very helpful. Again, you got to be very well hydrated. You got to get sleep. It needs different amounts of sleep. I've done shows on it in the past, not on podcast channel, but on others. Probably should do some more shows on sleep again. I sleep 4 to 5.5 hours a night, and I have tremendous energy. It's all my body requires. Basically, you're resting your brain and your eyes. So even if you have trouble sleeping, just lay there and relax. If you learn how to meditate, if necessary, it'll help you fall asleep. Things we should do and talk about sleep. It's a whole separate show in itself. To manage the stress in your life, course, I mentioned just before, I do TM. I've been doing it since Transcendental Meditation since 1976. So it's easy for me to do. I can do it on a subway car with noise around me. I don't need silence. Yoga is a great way to help reduce stress. Breathing exercises can help in the reduction of stress. And of course, everybody should get regular exercise. Get back into the gym, go out for long walks. Swimming is the best, safest, generally, if you don't drown, best exercise there is. Can reduce tension, headaches, and migraine frequencies and things like that. It's important to discover the cause of things because then you can focus attention on treating the cause of things. Now, there's something called the gut-brain axis. Get into the gut-brain axis. I've helped many people with headaches because they come into me with that just as a symptom. The symptom is caused by viral infections like the Epstein-Barr virus, monovirus, cytomegalovirus, viruses. It can be caused by Lyme disease. Medical problems can lead to headaches, kidney problems, so many different things, diabetes. And one of the most wonderful things about intravenous ozone therapy is that we're able to, in very severe cases, eliminate those problems, even in non-severe cases, but more importantly, the symptom of a headache can be gone. So if you're not getting anywhere, you may want to call the office in the city at 212-581-0101. I'll give it later again. Get you started with intravenous ozone therapy. We've done podcasts on it, so you can look it up. Ozone therapy, everything you need to know. I'm not going to go over it all now, but the details, but listen to that and it'll tell you a lot more about it. Do your homework. Okay. Probiotics help, and the answer is the gut-brain axis. The answer is yes. The gut connects to the directly to the brain, and it can help with reduce so many different things in the help, and the evidence is there. It's all in the medical literature now. And that's why I said Doctor's Biome at the beginning. I was going to talk about it some more because of its 15 proprietary strains are capable of surviving the stomach, and all the strains that have been tested for headaches are in it. Okay, those strains that have been tested are already in it, and they're capable of surviving the stomach and sticking to the wall of the gut where you need them. That's where the gut-brain axis comes from. Then you may notice just by taking probiotics on a daily basis, and it comes in these delicious 2-ounce shots. Okay, the bacteria are living in a 100% delicious organic vegetable fruit juice. Okay, you take 1 2-ounce shot a day, and within a month, you may find that it made a major difference in your general health and especially in your gut health. And they give you 100% money back guarantee. So if it didn't help your headaches and that's what you were taking it for, you don't have to worry that you wasted your money on it. They'll refund your money. And olive oil to reduce that inflammation, olive oil and organic berries and organic leafy greens have also been proven beneficial in helping with headaches. Beans and lentils are also very valuable. I don't go to the fermented foods because I have doctor's Biome, so I don't have to be bothered with fermented foods because unfortunately all they contain is acidophilus. And obviously, aiding the digestive process stops headaches. In the stomach alone, there's a nerve response that if your stomach is nauseous, you can, from eating something, you can get a headache. And if you have a headache, you can become nauseous. It interacts that way. So this can all help it. The thing is, you got to avoid alcohol and cheeses and artificial sweeteners and generally excess caffeine. Foods lead to headaches in people, if for nothing else. And some people just have sensitivities to these foods. So hopefully this has given you an idea on how to manage your headaches, what you can do for them, and with them. If you have any questions, oh, by the way, remember, go to doctorsbiome.com, DOCTORSBIOME, doctors all spelled out, biome, BIOME.com. And if you use the coupon code Howard35, you'll get 10% off the retail price. Howard35, and you'll get 10% off the retail price. But if you go on auto ship, I believe they call it subscribe and save, you'll get an additional 10% off the retail price. You'll make sure you get it on priority shipping every month, free shipping anyway, but they run out all the time, and this way it'll come to you promptly. And with that, make a major difference. For those of you that want to do home care ozone therapy, rectal insufflation, ozone enemas may be very beneficial for your problem. And if you go to promolife.com, PROMOLIFE.com, and call them at 888-742-3404 and get set up for ozone home care. Able to drink ozonated water that you'll make and do rectal insufflation. And this may be major helpful and save you the trip to doctor's offices for the different methods of ozone that are out there. If you have any questions, feel free to call my office at 212-581-0101. That's 212-581-0101, or email me at ozonedoctor@yahoo.com, OZONEDOCTOR@YAHOO.com. And stay healthy, stay well. We'll be back soon. Listen to all our shows and tell your friends about it. And again, please subscribe. Thank you very much.